Hello everyone, my name is Aakash Bhattacharyya, and I'm here to talk to you today about a major global health issue, and that is Salmonella. More specifically about my most recent research project, which is titled Early Detection of Critical Salmonella Cases for Preemptive Treatment. But first, a little bit about me. I'm a rising senior at Little Rock Central High School, located in Little Rock, Arkansas. And I participate in many extracurriculars, including first research, where I presented in many national competitions and international competitions, such as ISEF, National JSHS, Stockholm Junior Water Prize. I also do a lot of volunteering in the Arkansas Food Bank, local library systems, and many more. I participate in the Olympiads, such as Math Olympiad, Physics Olympiad, and Chemistry Olympiad, where I've obtained many honors, and other STEM competitions. In my free time, I like to play with my cat Beat, which is pictured here. Painting, I like to play basketball and pickleball with my friends as well. Now on to my research project. So first, when I want to explain my project, I want to first introduce Jane Doe. So this is Jane, and a little thing about Jane is that she loves ramen. Unfortunately for Jane though, the last time she had ramen, she was exposed to salmonella. So let's see how her case progresses. After one day, or day one of her case, Jane still feels fine. In fact, she doesn't even know that she's sick yet. But that all changes by day two of her case. At this point, Jane starts to feel generally ill and have mild diarrhea, and she finally knows that she's sick. And because of this, she visits her doctor on the next day, day three. And on day three, when Jane visits her doctor is able to identify her disease as salmonella, but is unable to assess whether her case will continue to be mild and go away on its own, or whether her case will develop into a critical condition, where earlier treatment can be the difference between life and death. Because the doctor is unsure, he is forced to treat Jane's case like a mild case, telling Jane to just take a rest. So that's what Jane does. On day 4, and then day 5, and unfortunately for Jane though, on day 6, her case develops into a critical condition, and she is rushed into the emergency room. At this point, Jane's case can have a case fatality ratio as high as 30%. In other words, Jane's life could be in serious danger now. And Jane's situation is not as uncommon as we might think. In fact, every year, 1 in 10 people fall ill with a foodborne illness globally. And Salmonella is a major cause responsible for over 100 million cases worldwide annually. In about 8% of these cases, which equates to over 8 million cases a year, Salmonella causes a life-threatening condition, just like we saw in Jane's case. And these conditions, again, can have case fatality ratios reaching as high as 30%. But this is preventable. If we look back at Jane's case, Jane's condition only had such a high case fatality ratio because the doctor was only able to start treatment on day 6 of her case. But had the doctor been able to assess her severity and provide treatment just a few days earlier, on day 3 itself when Jane first visited the doctor, the case fatality ratio of her condition would have been reduced to lower than 1%. That's a reduction of over 30 times, which is where my research comes in, which is to provide a framework for doctors to be able to identify these critical cases of salmonella early on, allowing and facilitating for that preemptive treatment that can reduce the case fatality ratio of critical cases by up to 30 times. And in my research, I accomplished this to 2 main objectives. The first, by identifying novel genomic biomarkers for clinical severity in salmonella, and the second, by developing a machine learning model based on those discovered biomarkers the doctors can use to rapidly and accurately identify critical salmonella cases before the onset of critical symptoms. So in my research, I obtained clinical data of salmonella from the Patrick database. I filtered this data for the required fields such as host health, host age, host gender, and some other fields. And from the available data, these were all the case outcomes listed. And after contacting salmonella researchers and experts, I was able to sort them into the following severity categories, that being critical, moderate, and mild. From here, the cases stratified across those set severity categories. On top of that, the cases are stratified across 6 set age groups and then on 2 genders. And so these are all the different strata created. And for example, the first strata would be male patients aged 0 to 2 years old that were critical patients. And so from all these different combination strata, I randomly selected a total of 99 cases while ensuring all the different data types were more or less equally represented within the selected group. From here, I downloaded the genome data of the cases I randomly selected for. However, this is a lot of data. In fact, genome data is vast and highly variable, and this makes interpreting it at a vast scale nearly impossible. Because of this, in my research, I implemented a novel approach for bacterial diagnostics by representing the genomes in terms of protein family domains, or PFAMs. And PFAMs are essentially conserved functional groups, so it's categorizing these proteins based on functional features. And this makes the data much more interpretable, much simpler, and easy to compare. So the genomes are converted into PFAM representations through a tool called HEMR, which works on a hidden Markov model. And after obtaining the PFAM representations for all the genomes, I loaded it into a database. Now in this database, I now had millions of records of PFAMs, and so I conducted a rigorous data analysis and data discovery on these millions of data points in order to curate novel PFAM biomarkers for clinical severity in Salmonella based on strong statistical associations. And from this vast search, I was able to locate 70 PFAM biomarkers for clinical severity in Salmonella. And not just that, of that, 30% of these identified biomarkers were domains of unknown function, otherwise known as completely unknown DUFs. And so these DUFs obviously open up a new door for research in the future, but in this research project itself, I intended to predict the functionality of these DUFs through analyzing their protein-protein interactions. And so I was able to predict a great deal of DUFs functionalities through this analysis. But ultimately, I wanted to create a tool that could predict the severity of cases with a high accuracy. To do this, I developed a machine learning model with the XGBoost package based on these biomarkers to see how accurately it could predict the severity level of cases. And so this model, based on these biomarkers, achieved a 93% accuracy on classifying the severity of cases, and more specifically a 96% accuracy on critical case predictions with a near perfect ROC curve. So overall, I was able to conclude that the 70 PFAM biomarkers I created was extremely effective at predicting the clinical severity of cases, and the machine learning model I developed based on those biomarkers would be able to identify critical cases accurately way before the onset of critical symptoms, and this would facilitate that much needed preemptive treatment that can improve global health everywhere. And this model can be implemented through metagenomic sequencing, which can be done within 1 to 2 hours for bacterial samples. And from here, it can be implemented to my machine learning model with that biomarker information for those rapid severity predictions. These are my references. Thank you so much for listening. I'd like to thank my mentor, Dr. David Ussery, for mentoring me both through the research process and the publication process. Thank you.